I saw a good quote that says depression hates a moving target. So if you're moving your body, even if it's not like a structured somatic therapy, literally just moving your body in any possible way, going for a walk, rolling around on the carpet.
I've never heard that, but that's
wiggling
such a
your
good...
arms around, right? Depression hates a moving target.
That's really cute.
Right?
That's
Isn't that a good way to put it? It's like not shaming you into like, well, if you just exercise, you can beat your depression.
Go outside in the sun. Yeah. Well, sometimes it's hard to get out of bed.
Exactly. But I like that idea that you're kind of like on the run from this thing. And
can't catch me depression.
Yeah, exactly.
Going out in the sun.
Yeah, and it's not like you have to go on a run every day to beat depression, but it's more like the more you're moving, the more you won't kind of fall into this stuckness, I guess.
They said that we'd grow out of it. Well, the joke's on them, that's just our brains. We're eccentric, loud, and stubborn, and most of our clothing is covered in stains. It's not a deficit of attention, there's just too much to think about. So if executive dysfunction becomes a little too much, if you forgot why you came in this room, or you're hypersensitive to touch, then put on your seamless socks and come join our little flock. Bitches stimming together, we're weirds of a feather, weirds of a feather.
Okay. Hear ye! Hear ye!
Wait.
Oh, yeah. Hear ye! Hear ye!
Coming from Middle Earth.
Ooh. It's Weirds of a Feather, an AuDHD-Adjacent podcast. I'm your host, Grace Beret.
And I'm your host, Kristen Stanhope.
And thank you for joining us this evening.
We're going to do the whole show like this.
Yes, get ready to be annoyed because we cannot stop talking like this. I'm really enjoying it. Kind of fun.
Yeah. Have you ever been to You know.
I know.
You
like
know.
a run fair of medieval.
But
medieval
the place.
times. Medieval times. Yes.
Thank you.
I have not been to
Can
medieval
we go?
times. I would love to
go.
Yeah.
Is there one in Maine?
There's one in New Jersey. I think that's the closest one. Yeah.
Let's go to the airport.
All right. All right.
I want to
Let's
go.
see. It looks fun.
It looks
like a great
fun.
time. I think
I would go to that would be like the only reason I would want to go to New Jersey.
Yeah, same. Either that or I have a flight.
Let's go. That's a weekend trip for sure.
Yeah, we could make a whole road trip out of it.
Yeah, we could road trip. And then we go watch Hotel TV.
Oh my God.
That's like
Screw Broadway.
The perfect weekend right there. 3-day weekend trip.
Medieval times and Hotel
TV.
Yeah.
Back by Sunday morning.
Great. Ideal. Yeah, there's quite a few of them. Chicago, New Jersey, Orlando, Florida, California. Yeah. Jersey's definitely closest to us. We could do it. It looks
Let's
fun.
go.
Yeah. All right.
I keep seeing TikToks about it.
Oh.
But.
Great.
Yeah.
Okay.
Let's go.
All right.
Let's go.
I'm in.
All right.
All
well,
right. There's that.
Now
that we've covered that.
Yeah. Now that we've covered that.
Yeah.
We have an episode for you today. It's a little serious, but don't worry. It's not too serious.
It's still us. It's still us.
It's still us. Do you have an accomplishment?
Yeah, I do have an
Let's
accomplishment.
talk about our accomplishments.
Right. And then we'll get into some meat.
Yep.
Because this is a meaty episode.
It's a meat episode.
Despite what you may think.
Yeah.
Yeah.
You would think
Kristen's got some information.
I actually have information to share.
All right. Let's do those little accomplishments.
Yeah. Little accomplishments, but big in our hearts.
Yeah.
Yeah. Grace.
Oh.
You want me to go first?
Yeah.
Okay.
Kristen.
Yeah.
What did you accomplish?
I have made an enemy.
Oh, sick.
I know.
Is it a child? I love a good enemy.
No, it's not a human, unfortunately.
Oh. Animal?
Yeah. Cucumber beetles.
Oh. Don't know them.
Yeah. I was looking in my garden. I was like, oh, these are cute little yellow beetles. And I looked them up. Well, they're like devastating to cucumbers. They're called cucumber beetles.
Oh.
Little bitches. And they're everywhere. So
I'm gonna check these out.
Yeah, they're like little stripy guys.
That's not nearly as fun.
I know.
That was gonna be a person.
Well, I also have Gary the groundhog, who's
still not a person.
Yeah, not a person.
Oh,
but
they're so cute.
The
are
stripy
they
guys?
invasive or do they just eat your cucumbers?
I don't know what they are. They're gonna die, is what they're gonna do.
Okay.
So and the thing is I want to kill them, but I don't want to. Someone in our neighborhood has honeybees who have been doing a great job of pollinating all of my cucumber flowers, and I don't want to kill the bees. And we have all these like big bumblebees. We have a lot of bees in our neighborhood. There are honeybees, there are bumblebees, and there are other native like mason bees. So I've looked it up, and this is what I'm going to do. I'm going to get nematodes, which are real things.
Oh.
And not just from Doug.
Oh, I was like, why do I know that word?
Yeah, because they were like, that was their like mascot, right? The nematodes or something.
I think you're right.
They're like microscopic worms that you can put in the garden, and they eat all the larvae. Because not only do these cucumber beetles, not only do they like the larvae will eat the roots of your plants, but they can spread, like they like spread cucumber STDs.
Wilt.
Yeah.
What is it?
And I think that's what happened last year to my cucumbers.
Bacterial wilt.
Yeah, they spread some sort of virus.
Because you can vacuum them up with a handheld vacuum.
Well, they also
that
said...
sounds fun, actually.
I'm going to go out there probably tomorrow with petroleum jelly and a glove, and I'm going to just like grab them.
Oh.
And I'm going to murder them. And then I already ordered my nematodes. And then I'm going to, you can use old tomato leaves and you stew them to make tomato leaf tea.
Oh.
And you can spray that on the plants, and the bugs don't like it.
That?
Apparently.
Huh.
TikTok is a wonderful resource.
There's so much that you can learn on there.
Yeah. Because they also said to put like yellow glue traps out there, like the sticky traps.
Yeah.
But I don't want to catch any bees.
Yeah. And that'd be sad.
Yeah. I'd be really upset. So I'm trying to figure out how I wanted
just picking them up one by one. That sounds fun. You get to look for stuff.
There's so many.
I love looking for stuff.
Yeah. Well, you want to come over and help me with my cucumber bee?
I kind of do.
Problem?
I love looking for stuff.
Yeah. I'll give you some gloves and some jelly, and let's just go.
Just go nuts.
Yeah.
Bring my
BRB
handheld
guys.
vacuum. Yeah.
Yeah. Oh, bring the vacuum.
Suck them up. Yeah. Yeah.
And then I can show you Marceline and how she keeps trying to be a mom.
Oh,
I know.
Poor lady.
Trouble on the homestead.
Yeah, apparently.
But yeah,
teen daughter.
I'm excited. It's nice to have like something that you hate.
Yeah, if it's something that you can like take care of immediately and quickly,
It's also
nice.
like the research of like how to destroy a population of beetles.
Isn't that fun?
Something nice and like just I don't know, like the guy from Caddyshack. Just nice to have an enemy.
Never seen it.
What?
Yeah. And I don't care to. And I don't plan to.
Okay. We have to move on.
Okay.
What have you accomplished?
I booked an Airbnb for the wedding that we are going to go to this coming weekend.
Hey!
And I did it 2 weeks ahead of time.
Hey, okay.
As opposed to like the night before, So.
You know what's wild to me? People who are like, they get the invitation for the wedding, like what, 6 months in advance or something?
So long.
And then they see the invitation. Who are these people who they look at the invitation, they RSVP yes, and then they immediately book a hotel.
Right? They're like, oh, we better get on this now.
We better get on this now.
I always say we should do that now, and then I don't.
I know they exist, but who's doing that? That's crazy
the
to
most
me.
type A amongst us. I bet Kylie does. I bet Kylie does that. I bet Tori does that.
Unreal. I'm always like, they're booked
Mo.
out.
I could see Mo doing that.
Oh, yeah, Mo
maybe
would
not
do that.
quite immediately.
I'm like, I don't know my schedule. I don't even know what I'm doing tomorrow.
Mine isn't a scheduling problem. Mine is just, I don't want to do this right now. And then I wait until it's almost too late. Well, the other thing was we were planning, because there's like a campground that you could stay at, but we were planning to hopefully take my parents' camper. That's the one weekend they are using the camper to go to like some festival.
Of course.
I'm like, well, great. So there went our plan.
What about your van?
No, it's not registered and it needs some things done. So, I was like, well, I can't take that. And I was like, well, let's just like tent out, I guess. But he made the good point that like there's not going to be air conditioning. And you're
getting ready for a wedding.
There's like bathrooms there and stuff. But
it's not the same.
I know, but I didn't want to spend money and I was being lazy. But finally, last weekend, I was like, all right, we need to do this.
You need to
did it. One spot left.
I'm excited.
Boom. Got it. And now we're all set.
There you go.
Look at
and
me
isn't that like a
on it.
relief?
Yeah. It
Especially
is a
when
relief.
you're
It
like,
feels good.
I gotta like get this.
I've been stressed about it for 6 months. So, so here we are. I did it.
Well, I'm proud of you.
And I did it with time to spare, and I got a
I know.
good place. It's a bed and breakfast. It's cute.
Oh.
Yeah. It has an air conditioner in the room. So I'm
Adorable.
excited. Got a dog sitter.
There you go.
Parents are going out. Oh, yeah.
Mom and Dad's weekend out.
Hell yeah.
Hell yeah.
Yeah. One of my
That's
Vermont
so
friends is getting married. So
So
it'll be
exciting.
fun. Yeah.
Yeah.
And then our listener and friend Susan just shared a little accomplishment that I want to just give a shout out because it just popped up for me this morning. And I was like, that is a great one. She said she got an iPhone a few weeks ago and she just threw the box out.
There you go. I've held on to those boxes for years.
I still have them. I still
what-
have them
what are
from
we doing
iPhones
with
I
these-
don't even have anymore.
I don't even, yeah.
Well, iPhones used to also come with like a bunch of stuff in the box.
Right.
You
with
get
the
like extra headphones,
and
you
a
get like
jack
a charger.
and a charger.
Yeah.
Now they're like literally just the phone and they're like figured out.
Yeah. Buy the dongles yourself, bitch, because none of your stuff is going to fit with one another. Yeah. I don't know why we keep the boxes, but we do. And so Susan threw her box out
Proud of you,
pretty
Susan.
soon after getting a new iPhone. I am proud of you as well, Susan.
That's
That
great.
is a little accomplishment. Now you're not going to have to find it floating around years later in a drawer and be like, why did I keep this?
What do I need this for? And then you're like, well,
Yeah.
what if I like put a gift in it? But I don't want to put something in an iPhone box because then they're going to be like, oh my God, you got me an iPhone.
Yeah. It's like, well, now that's
No.
going to be disappointing.
Yeah.
Womp womp.
iPhone 4 box.
Yeah.
Ooh,
Ooh.
iPhone 4.
It's retro.
Yeah.
Yeah. But yeah, congratulations, Susan. We're proud of you.
Proud of you, Susan.
Yeah.
Yay.
Yay. All right.
Should we move on
Now,
to
officially,
the meat?
It is the meat.
It is meat.
Meat.
So this week we're going to kind of temporarily wrap up our substance use disorder series
Yes.
because I've decided that we are.
Okay. All right.
The past several heavy episodes, we've been discussing ADHD and substance use disorder. We've discussed the co-occurring rates between SUD and ADHD, how different substances affect the brain differently, and why an ADHDer would or would not want to be attracted to those more than a neurotypical. Have we covered all the drugs? No. There's more out there. There's plenty more. Have we discussed all the social addictions I wanted to cover, like social media and hoarding and gambling? No.
I think we should do social media at
Yeah,
some point because
I-
I have a problem.
Yeah, and gambling is a huge problem.
I don't have that problem, but I have other problems.
Yeah.
And
Social
gambling
media-
does. I mean, the friggin' sports betting.
Yeah.
It
It's
is
crazy. And it's
tearing
all
its way
rigged.
through men. Yes. If you get too
Get
good at
off-
it, they'll kick you off the app.
Get
There's no way to
off
succeed.
DraftKings. It's all rigged anyway.
It's MLMs for men.
It's-
99.99% of you will not make money of it. And no, you are not the 0.1% who
No,
will. It's the people
you're
at the top.
And
it's not you.
It's all rigged anyway. And
Yes.
the people who make money on that are like inside trading because they already have like knowledge about it.
Yep.
Don't
You're being played.
stop sports betting.
Yes.
Unless it's like a fun little like square thing with amongst friends, that's cute.
But even that, if you get too into it,
Get
it
off
can be a slippery
DraftKings.
slope. I would say just don't even do it. If you have any type of attraction to gambling,
Mm-hmm.
I feel like anything is just gonna be a slippery slope. Because once you get that hit, the dopamine hit of I won,
You're like,
you're always gonna want some more.
and it's always going to be like, oh, this is my next big break.
Yeah, the
I'm going
next
to make
one.
up for it in the next one.
just like social media on TikTok, when you're scrolling the FYP, you're like, your brain's like, the next one will be like what I'm looking for.
Yeah.
The next one will be what I'm looking for.
right.
And it never is.
Never is. Yes, I would like to do all of those at some point, but my brain is telling me we have to move on. 'Cause
Okay.
There's a lot of other topics I want to cover, like hormones and ADHD, and I thought I'd kind of revisit like, how you're supposed to take your medicine, don't mix it with orange juice, and why that is a thing. Yeah, there's a lot of other topics I want to cover, and I'll probably come back to these when, I'm not sure, but I just want to move on because
I understand.
It's sad. It's bumming me out. So
yes, that's valid.
I want to move on.
Okay.
I want to the last thing I want to cover is treatment because it's important. And I think it's not all hope is lost. So let's recap. Let's just do a little recap of what we've covered.
Okay. And then at the end, don't let me forget, I have one product that I've been wanting to talk to within this whole addiction series that has been offered. It's those feel-free Kava Kratom drinks that are offered as an alcohol alternative. They are extremely addictive, and people who are trying to get off alcohol have just become super addicted to this other thing. So I can talk about that at the end, but this might be a good time to just I'm just I had never heard of it until I heard a TikToker talking about how she was got so addicted to them. No one ever warned her. They're expensive. Right? She was drinking 9 a day. Yeah, they're $12 a bottle.
You shouldn't drink 9 of anything a day.
No, that's too many unless it's little cups of water. But I would have had no idea. And I've seen those at the store before, and it's offered as an alcohol-free alternative. In the grocery store? No, at gas stations and stuff, convenience stores. But there's not any type of warnings on it, and it's it really seems like there's absolutely no warning or regulation around it, and people are finding themselves incredibly addicted while trying to get off a different addictive substance.
Right.
So,
and there's also a lot of so one of the things I kind of wanted to talk about is there's a lot of things on TikTok that are this is natural Adderall and stuff like that. And
yes.
All it is usually B vitamins. But yeah. So other things we can talk about. But yeah. So let's recap what we went over, so we can realize why it's important to cover this stuff. 25% of all adults and 50% of adults with ADHD will have some sort of substance use disorder, which is astounding.
Crazy.
So 1/4 of the adult population in the world, and then half of all adults with ADHD.
We don't stand a friggin' chance.
Exactly. Those with ADHD are more likely to develop a substance use disorder at an earlier age. We saw that in smoking.
Yeah.
And then especially with smoking, studies have found that ADHDers have increased withdrawal symptoms. They have a harder time quitting, and they have a quicker relapse rate. And that's with most drugs, but especially smoking. And that's because the nicotine basically goes right to your dopamine receptors. And so it's literally the worst.
And also these percentages are just out of people who are known and diagnosed with ADHD. And as we know, the ADHD rates are way, way higher than what we know of them. And how many of those adults with ADHD are masking their traits or hiding their traits because they're using these substances to self-medicate. So I bet those addiction rates are even higher.
So yeah, and then kind of bordering on the concept of self-medicating, stimulant misuse is still a big problem, even though I think a lot of it is self-regulation. But it is misused, and this is why we have this issue. It's most common in college age people.
Yep.
Basically, people taking stimulants to help with study or perform well on a test.
That's where I tried it first.
Yeah.
And everyone's like, let's go out and party. And I was like, I got a bunch of work to get done all of a sudden.
Let me go to the library.
I just really want to study.
Yeah.
Yeah.
It's actually going to reorganize this cabinet.
Yeah. And I did.
Immediate release stimulants, so Adderall, IR, are more often misused because they can induce this euphoric effect, especially if you don't have ADHD.
Yeah.
Whereas the extended release formulations are less often misused.
It's interesting that, remember I was talking about that study a little bit ago about how people who take stimulants but don't have ADHD are less efficient and effective with getting stuff done. So it feels really good to them, but they're being less effective. So I guess that makes sense why it's a party drug.
Yeah.
Like alcohol.
Yeah. Well, the IR, the immediate release, because it's dopamine right to the dome, right? Yeah. So that would be more euphoric, almost as if you took crystal meth or something, like methamphetamines.
Sweet crystal meth.
Mm-hmm. Methylphenidate and methamphetamines are very, very different.
Yes.
They're different.
Yes. So stop saying, stop comparing stimulants to meth, because it's not the same thing. Just because there's methyl whatever in the name,
right,
doesn't mean
they sound similar. They're very different.
For chemicals, you can have the slightest difference, and it can be worlds apart.
Yes.
Yeah.
So stimulants in America are still classified as Schedule II drugs. And so what that means, per the DEA, which is the Drug Enforcement Agency, there's different schedules of drugs. So Schedule 1 drugs are drugs that have no medical use whatsoever. So that would be crystal meth. That would be heroin. That would be
LSD?
LSD, yeah. Totally illegal. I
Molly.
think.
Or no.
Yeah, because that's MDMA.
Yeah.
Yeah, there's no medical use for that we know of.
If they, because don't they, I guess this would be at the federal level, but in some states they do allow for like controlled MDMA and like ketamine therapy. What's up with that? Does that not count as a medical
I don't know.
use?
It would be at the federal level,
therapy?
so probably not. I think you would need like a special grant or something, permission to do that. I'm not sure.
Okay.
Schedule 2s are, and this is a direct quote from the DEA, which I'm sure you're pumped about.
I love those guys.
Schedule 2 drugs, substances or chemicals, are defined as drugs with high potential for abuse, with potentially leading to severe psychological or physical dependence. These drugs are also considered dangerous. Some examples of Schedule 2 drugs are combination products with less than 15 milligrams of hydrocodone per dosage, also known as Vicodin, cocaine, methamphetamine, methadone, hydromorphone, which is also Dilaudid, mirpyridine, which is also called Demerol, oxycodone, which is also Oxycontin, fentanyl, dexedrine, Adderall, and Ritalin. So
it's so crazy that stimulants are in the same category
as cocaine.
Yes, as cocaine.
And cocaine, they use it in the ophthalmology world to
give you a quick bump in the bathroom.
And then that way you're alert for your exam.
Yeah, you're nice and awake.
No, it's to dilate your pupils. Sometimes cocaine is good at doing that. So I think it's in like a dropper formation.
Is psilocybin a Schedule 3?
No. I think it's a Schedule 1.
Great. So dangerous.
Yeah, I don't think I think it's like 100% illegal. Yeah, Adderall is on the same. In all these drugs, like they do have like methadone and Dilaudid, all oxycodone, all have uses medically, you know?
Yeah.
They just also happen to have an issue of misuse. But you can misuse any drug.
Yeah, of
really.
course.
You
try hard enough.
You know, people overdose on Tylenol. So
psilocybin being a Schedule 1 is so crazy. I know that's not what we're talking about.
I don't know if it is.
It is. I just looked it up.
Yeah.
Yes. They have it higher than cocaine.
Yeah.
That's how you know that it's not actually bad, because people don't die from shrooms unless even if you take like
it's
a crazy
death.
amount. Yeah, your ego might die. But it's like the fact that they're saying psilocybin is more dangerous than coke and meth.
Well,
and fentanyl.
No,
Methamphetamine. You have methamphetamine on that list of Schedule 2.
Why is methamphetamine on there? I think they mean methylphenidate. DEA, get it together.
Honestly.
Because I don't think there's any. Yeah. And I copy-pasted that.
Oh, so I guess they're saying it.
That's interesting.
Yeah.
I feel like that's a typo. Someone needs to correct that, you know?
Yeah.
Our government's not doing well.
But even having psilocybin on the same level as OxyContin, fentanyl, cocaine, Vicodin.
No, these are all Schedule 2s. You're saying psilocybin
is higher.
They
have it as like,
so it's on the same as heroin.
Yes, they're saying it's more dangerous than cocaine and OxyContin and fentanyl.
Yeah.
Which is so crazy. And once again, these policies and laws are not in place to protect us, because the government doesn't really care about protecting us. It's for their own selfish reasoning. And so I would just question that, you know?
Yeah.
Of why would psilocybin be so high despite it not killing people?
Mm-hmm. What's marijuana? Can you look that up? Now the changes.
Yeah,
there's been so many changes. Because it's still federally legal. And this is just in America. If you live in a nice country, aka not America, it probably is different. Yeah, anywhere else, really.
Yep, they have it as Schedule 1. Great.
Is it really?
Yep.
Oh my God.
So dangerous.
So funny.
And LSD,
that's
ecstasy.
Weird. Yeah, because federally it's illegal, but statewide it's not.
Isn't that crazy? That's still a Schedule 1, where they're saying like there's no legitimate uses of
People
this.
Are
it's
making
so dangerous and so addictive, but it's fine at the state level.
It's fine at the state
with
level.
Some states.
States' rights.
Like what?
It's totally fine.
Is it dangerous or is it not? It's not.
Yes. So I think that in part being Schedule 2 is like the misuse of Adderall is a real thing, right? It is rampant on college campuses, people taking it. And the other thing is like when you take Adderall or Ritalin or something you don't know what the dose is usually, and you don't know the release formulation, and you don't know what your body's going to do,
Yeah, and it can cause like heart problems, heart palpitations if you do have any type of like pre-existing heart condition.
Exactly.
Yeah,
and like
you definitely should have your
one. You might take an extended release Adderall one day and then get an immediate release the other day, and you're like, why are these two so different?
Yeah,
because they are.
Yeah, you should definitely be going through a doctor and be like monitored on that stuff. So, but so are like there's so many medications that are like that. You know,
and I think with the misuse and having the Schedule II classification only leads into the stigma of like. I think there's a lot of stigma still around I feel like we've come so far, but there's still like, and I wonder if that's because you and I are in kind of our own echo chamber, especially with like all of our people who are on like Reddit and on Instagram, and they're like, oh, I feel this too, and I'm like, oh, well, everybody must feel that way, but no, people don't. There's still like a lot of stigma about ADHD. And that it's like not a real thing. And that, you just want to take Adderall to study more, and that you don't really need it if you would just like sit down and try harder. There's a huge stigma around ADHD still. And it's not just among the general public. It's also with like the medical community.
Oh,
I think,
of course.
Right.
And we also, as ADHDers, have so many internalized ideas around laziness and productivity and medications and what we should be doing and trying harder.
Yeah, like when you go try to get like a diagnosis, the first thing you're instantly like not believed,
Oh, like because they think you're drug seeking.
Yes, exactly.
Especially now with so many people going in for assessments.
They're like, oh, everybody must be drug seeking. How can this have happened?
Or everyone thinks they have it.
Right. Well, they probably do.
Yeah, it's almost like millions and millions and millions and millions of people are undiagnosed
and just raw dogging it, know? So I think there's a lot of stigma among the medical community. I think there's a lot of stigma amongst the general public, and I think all of that makes it especially an uphill battle to treat ADHD in general, but especially when you have a substance use disorder on top of that. It's tough.
And I know there's a lot of hesitation around like medicating children, especially, which I fully understand. It's like their brains are still developing. And is this just like normal kid behaviors, or am I taking something away from them by doing this? But so it's like there's this fine line between like waiting or not wanting to just like jump right to medication, but also like for a lot of adults who have gone undiagnosed, they weren't given the medication that they needed, and they've developed these compensatory substance addictions. And then by the time you finally get diagnosed at 25 or 30 or 50 or whatever, you've already become addicted to the substance that you've been using for so long as a strategy. And so it's like, I think keeping that communication open between you and your kid. And
there's also a lot of studies coming out that I kind of want to talk about show that, children who are treated with stimulants, they're less likely to develop a substance use disorder because they aren't seeking that. They don't know if it's like, is it like permanently altering their developing brain? They're not quite sure.
Yeah.
Or is it that they're just being treated and they're not seeking anymore? Yeah. Kind of hard to tell. But not only are they less likely to develop a substance use disorder, but they are less likely, especially with, I think it was smoking. I'll have to go back and see. I think it was with smoking. They're less likely, or if they do develop a substance use disorder, it's at a later stage in life or later.
Save the drugs for later. We always say that.
Later onset. So like smokers, instead of starting at like 14, they'll start, maybe at like 20.
And that's nice.
That is nice. It's a whole 5 years.
And the meds, it could be a double whammy where like not only are you, because you're properly medicated, you're not like dopamine seeking as much, so you're not as likely to take these exciting substances, but also you're not looking to like escape as much because you can actually like do your schoolwork and you can follow through on things like Ted was saying with his son, where they finally got him on medication at like 15, I think. And then like his grades shot up and he was like, had all these passions and he was able to like follow through on them. So it's like, you also are able to create, when your brain has what it needs, you're able to create more of a life that doesn't need escaping from.
Right. Exactly. And so I think the issue is if you have a substance use disorder, the last thing you want to do is give someone a drug that has the potential for misuse. That is the dilemma that I feel healthcare practitioners are finding. This person has a substance use disorder, but they also have ADHD. What do we do?
Yeah, that is tricky.
You don't want to give them something that could potentially, or especially if they're in kind of a crowd where there's a lot of like risky behaviors, you don't want to add to that. But at the same time, let's talk about a couple, and these are just a couple of several studies that I've read or kind of breezed through. I just wanted to highlight a couple of them. So one, there was a trial that showed atomoxetine, which is also known as Strattera, which is a non-stimulant. They used that with alcohol use disorder, and they showed that treatment with atomoxetine reduced heavy drinking episodes in people with ADHD, which was found to be dose dependent. So people who were on 60 milligrams had fewer days of like heavy drinking compared to people who were not on that. And then when they bumped them up to 80 milligrams, I believe it was 80, that they found that those heavy drinking days were fewer in between.
Whoa.
Yeah.
So it's not like a either on or off. It's
right.
Yeah.
So that was pretty encouraging. This one, I think I sent you a picture of it, or meant to. There's a journal called the British Journal of Psychology, but they just call it BJ Psych.
BJ Psych!
Just like,
be the best!
One great DJ name.
Yeah, BJ Psych.
And I just
love it.
Kept laughing at it. So a study out of BJ Psych showed treatment of ADHD with stimulants were found to reduce the risk of the individual developing an SUD or substance use disorder later on in life. And then there was another study from the NIH that treated adolescents with cognitive behavioral therapy and methylphenidate versus cognitive behavioral therapy and a placebo. And it didn't really show a reduced number of days without substance use/abuse. But the subjects themselves reported a lot of improvement of what they would call secondary symptom improvement. It basically said that taking that medication not only improved their ADHD symptoms and traits, but they felt like they had better problem solving, basically less impulsivity when making decisions around using substances.
All right. So that's good.
Which is an improvement. And that's just one study. There are so many more about like, should you give stimulants? Should you not give? There's just a lot. There's a lot of good, like, positive studies going on right now. And there's a place called, I just want to give a shout out to a place called SAMHSA.
Oh, yeah, SAMHSA.
Yeah, we've talked about them before. SAMHSA. They're like an advisory group, and they do a lot of research with ADHD and substance use. Same with ICASA, which is a international, we've talked about this before, international group that does research with ADHD and substance use internationally. I think they're based out of the Netherlands, but they're an international group. I think the SAMHSA is based out of Australia, maybe. So taking everything into account, like what are we doing as like providers here? I think the moral of the story is every person is different. Everybody's an individual, and you really have to base it off them as an individual, as you should with all medicine.
Yeah, of course.
Right?
Yeah.
That's kind of, medicine is individual. But based off my very informal internet research mixed with a personal opinion and probably a lot of bias, this is what I think.
All right.
Number one, harm reduction first.
Yes.
I think that's a given.
Yep.
When treating a patient, you want to focus on reducing the most harmful behaviors first. Are they injecting? Make sure they have safe needles. Are they participating in like unprotected sex? Maybe educate them about condoms and protection,
Yeah, instead of like some kind of abstinence only approach when it comes to substances.
Harm reduction first. And focusing on that first.
And not using shame, I would put in with that one, because shame is not an effective strategy for ending these habits, because that's just not how it works. And if anything, that might cause them to use even more, because they're trying to probably cover up some shame that they already feel.
Exactly. And I think if you're in, it's going to be hard if you're like a primary care, you have 15-minute appointments, you're seeing like 25 people a day. That's crazy. Yeah. And it's hard to have these like big heart-to-heart connections with these people, these freaks, with patients who are coming to you with like a serious thing. This isn't a blood pressure checkup, but they're trying to like bare their soul to you. It's hard to have that connection. And so, if you have someone who's like, heavily drinking, it's hard to just be like, hey, like, you got to cut down.
Yeah.
Oh, good. Thank you.
Yeah.
For letting me.
I need to cut down. Thank God you said that. Oh, all right. Well, then I'll just do it.
And I get that it's difficult, but harm reduction first.
And the less shame that you use in that visit, the more likely they'll be to come back to you and to tell you the truth. Because so many people are scared to even tell their doctor what they're doing. It's like, if you can't tell your doctor, who can you tell? But also, I get it, because so many doctors
are like,
make you feel so judged if you even say that I smoke weed. It's like, oh my God. It's
I don't care what you do.
Yeah.
I just need to know about it, because sometimes, drugs have consequences when combined with other drugs, like anesthesia.
Yeah, and that's so important.
The one person you should never lie to.
Yes.
You can lie to a surgeon. You can lie to your primary care. It doesn't matter. It does, but the one person you cannot lie to is anesthesiologist. You can't lie to them. They'll kill you by accident. They don't mean it. Don't lie to them.
And they're not judging you. They're not going to arrest you if you say, I took this thing. They just want to make sure they don't kill you.
Yes. That's our one goal.
I've
don't
read
kill the patient.
so many Reddit stories of that happening, of men denying that they've taken like meds for erectile dysfunction and stuff like that. And the doctor says like 12 times, like, it's okay if you did. I just need you to tell me. And they're like, nope, not me.
Or they'll lie about eating breakfast that morning and then they aspirate. Yeah. Don't lie to them. They're trying not to kill you. Anyway, it's another number 2.
Yeah.
Therapy.
Yes.
Everybody needs therapy. And I know this is like a given, but it's very difficult. Christopher was on the waiting list for a year almost. It's crazy.
And not necessarily just talk therapy. I know that's kind of our, the one that's the most popular and the most common. And I'm not saying that doesn't work, but also if you've tried it and it hasn't worked for you, or if you're like, that doesn't really sound like what I need. I know I always say this, but look into somatic therapies
this
as well.
Episode brought to you by tapping.
Try out tap. I said somatic therapies, whether that's tapping or a different kind. You can there's different types.
Try screaming into the wind.
Yeah, go scream into a void. That can help as well. Screaming in your car, go on a roller coaster and scream.
Look at the sun with your bare eyes.
Yeah, straight into the sun for 5 minutes minimum, just really get that vitamin D right in there. But no, really like physical and nervous system based therapies. I saw a good quote that says depression hates a moving target. So if you're moving your body, even if it's not like a structured somatic therapy, literally just moving your body in any possible way, going for a walk, rolling around on the carpet.
I've never heard that, but that's
wiggling your arms around, right? Depression hates a moving target.
That's really cute.
Right?
Isn't
that a good way to put it? It's like not shaming you into like, well, if you just exercise, you can beat your depression.
Go outside in the sun. Yeah. Well, sometimes it's hard to get out of bed.
Exactly. But I like that idea that you're kind of like on the run from this thing. And
can't catch me depression.
Yeah, exactly.
Going out in the sun.
Yeah. And it's not like you have to go on a run every day to beat depression, but it's more like the more you're moving, the more you won't kind of fall into this stuckness, I guess. Yeah.
Yeah. I completely agree.
Right?
Number 3.
Yeah.
Moving on. Stimulants are still first line for ADHD.
Gold standard.
They're the gold standard. It always has been, and it probably right now it always will be.
It's been studied for so long. I don't know why people act like this came out of nowhere. It's like, this has been studied for like 50 plus years.
Right. And it's always been the first line. There's never been anything better for ADHD than stimulants. So from what I'm reading, from the studies I have read, and my bias that I'm very clearly portraying, it seems like that should be tried first. Maybe use first-line agents first. That's why they're called first line.
In the name. Yeah.
Right. That being said, everybody's an individual. And so if, someone's taking part in risky behaviors, like they're, selling their medication, or they come back and they're calling in, they need like earlier and earlier prescriptions. There's all these like prescription monitoring things that we can use to kind of see if someone's being involved in risky behaviors. But just because you're like, well, he might, doesn't mean that he shouldn't get the care that he probably needs,
Yeah, of course. Because any risk that he's going to take, I feel like can be mitigated by even, like you said, with the study where these kids didn't stop using the substance, but they were able to show more impulse control and self-restraint around it. You know, if you get on the stimulant, they'll have a better shot at making a good choice.
And then, and I'm interested to see what like future research leads to, because it sounds like everything is pointing in the direction of like you should treat ADHD as ADHD and then treat the substance use disorder. But if they're involved in such risky behavior, then maybe it's hard to treat one without treating the other, you know? Because they're intertwined.
Yeah, if they're like making super impulsive decisions, how do you treat their substance addiction without treating that impulsiveness? Right.
So if possible, first-line agents should be tried first, is what I'm reading in my interpretation of the literature. You know, but that's also why we have non-stimulants, atomoxetine and guanfacine, you know, and bupropion has a lot of good about like smoking cessation. That's one of the, it's technically off-label, I believe, but there's been a lot of good studies coming out about bupropion and smoking cessation. So and obviously it's off-label for ADHD. I have tried it personally. I hated it because I thought I was losing my memory.
Oh.
I told my primary care I had like early onset dementia, and she's like, why don't we just try something new?
Or it's this medication that we just put you on.
I was doing the classic, like leaving my keys in weird places, like the refrigerator.
Done that.
Yeah, it's anyway. So, and then lastly, before we like move on and get to our bod, we already talked about this, but if you're concerned about misuse or diversion of stimulants, consider A, extended release because they're less misused, or B, the non-stimulants, atomoxetine, guanfacine, propranolol, bupropion. Go back to our non-stimulant episode to hear about all of them. But there's lots of, I think the moral of the story should be you shouldn't not treat the ADHD.
Yeah.
I guess that's my bottom line. You should not treat it because it's there and it should be treated. And if you treat it, the other things will probably get better.
Yeah. It'll feel way harder to start with something else other than the ADHD, which is like the root of all the struggles. Yeah.
Right. So you should treat it. However you treat it, I guess I'll leave up to you because one, I'm like what is it called? Backseat quarterback? No.
Backseat driver?
Monday morning quarterback.
Backseat driver?
And Monday
Where's the quarterback coming in?
Monday morning quarterback. That's like a thing.
Oh, where you're like,
if I was Tom Brady, I would have done ABC.
Totally.
Right?
Yeah.
That's like a very common saying.
Oh, I'm not in the football space.
Well, it's not just a football space. It's like
I'm not in any
common
space
language.
where that's a common language.
It's an idiom.
Oh,
but I'm mixing my idioms into a metaphor.
You never do that. Yeah. Yeah, I can't wait to listen to that back and hear exactly what you said. Backseat quarterback. Yes, the backseat quarterback. Yeah. Infamous.
But yeah, I think bottom line, ADHD should be treated. It shouldn't be ignored. It's like a huge problem amongst substance abuse and probably like a root cause.
But also treating the ADHD isn't like magically gonna fix everything either.
No, that's
the other thing.
Yeah,
pills don't teach skills,
right?
Unfortunately,
you need both.
Yeah,
but one could help make the other a little bit better.
Yes, that's a good way to put it.
So that's what I've come. That's my conclusion. If you disagree with me, please write in at widgetofeather@gmail.com. Do you want to argue? I'd love for it. Do you want to complain? I also love complaining. Let me know. Did you hate my very biased opinion about?
It's not even that biased. It's based on like the most common medical advice and research.
It is.
Like you're not biased.
I guess I'm heavily putting my own bias in because I feel like,
as someone in the medical field, I think like you're qualified to do that. It's not like
it's a little biased.
You're not even on stimulants, and you're saying yes to stimulants. So
yes,
that
to
alone
stimulants.
feels like you're not biased. If I said it, it'd be like, all
but
right,
I'm
well,
also
Grace just
like,
loves
I'm
stimulants.
a surgery PA who's never practiced in primary care.
Yeah, but you've done all the schooling, and you're in the medical world.
I'm in the medical world. I dabble.
You do. You can write people prescriptions for things.
I do.
So this is you are qualified to have these opinions.
Thank you.
You're not just speaking out of your ass.
I did put a lot of, believe it or not, time and effort into this episode, but
I believe it.
But yeah, I think I just feel like sometimes ADHD is ignored because substance use is such a big thing when you see that and you're like, ugh, in the patient's chart. But anyway, let's move on to our bod.
Oh, before we do that, I want to talk real quick about those
Kratom.
feel free things. Yeah.
So what? So you wanted to talk about, there's a drink
I
that's
just want
been advertised.
Yes. It's like it's considered like a tonic,
Mm-hmm.
and it's called Feel Free. It's in this little blue bottle. It looks like a little
Like a
if you get the
5-hour
little-
energy drink or something?
Yes.
Okay.
I was gonna say like the little alcohol shooters. Yeah, one of those like little
Mhm.
5-hour energy bottles. They probably have them at least in the US. I don't know what it's like out of the US, but you can find them at like gas stations and stuff like that. This is one of those substances I would say don't even try it. There's no reason
Just
to
like
even
Whippets.
Yeah, just like Whippets. Don't even go there. There's no reason for you to know about it or to know
So what
that it feels
is it?
good.
It's called Kratom?
It's called Kratom. Kratom is like they act like it's this alcohol alternative, but it does seem to have its own addictive qualities. It's like, I think in the opiates family.
Oh shit, is it like a synthetic opioid? Ugh. How do you spell it?
Kratom. All right, this says Kratom is a tropical tree native to Southeast Asia. Consumption of its leaves produces both stimulant effects in low doses and sedative effects in high doses. It can lead to psychotic symptoms and psychological and physiological dependence.
According to the Mayo Clinic, it just says Kratom, unsafe and ineffective. So
Oh. This says Kratom's effects on the body include nausea, itching, sweating, dry mouth, constipation, tachycardia, vomiting, increased urination, drowsiness, loss of appetite, and it can leave you to have like seizures, hallucinations. Yeah, it's just like a sneaky thing. You know, it's one of those things where whenever they say this is, like you said, a stimulant alternative or an alcohol alternative, it's probably just a different type of substance that hasn't been used enough to have this social awareness around it of like, oh yeah, that's just like addictive in a different form.
yeah, it's just using one drug to treat the other use disorder.
And if you're gonna do that, at least choose something that's like not also super addictive. And it seems like these ones are, and people are like advertising them on TikTok. Like it doesn't seem like the conversations around it are even concerned, like Whippets or something, where it's like, obviously this is bad. The Kratom stuff seems like there are lots of people that genuinely don't know that are out there advertising it. I see so many people in the comments like, I've been drinking these for months and I'm fine. Like people get so worked up about anyone on TikTok talking about their own addiction to Feel Free. The people who I guess haven't reached that point of realizing that they're addicted yet or haven't become addicted to it yet are always like very quick to argue back because it probably does have some beneficial, nice feelings in the beginning. And so I'm sure people are not wanting to acknowledge that it's not just like an energy drink. There's more to it. And it does become extremely addictive. Someone was saying that they struggled to get off of opiates and getting off of these Feel Free Kratom drinks was like the same level of challenge
Really?
as getting off of
Wow.
opiates. Yeah.
Wow.
It's just really like sneakily addictive.
Yeah, I think there's a lot of, it's very predatory, it seems like.
Yes.
And there's a lot of that with ADHD. I found, like on TikTok especially, there's a lot of these like, take these drops and it's like natural Adderall.
Yes.
And maybe we can do a whole episode on that because there's a lot out there and you're like, either this is just really expensive vitamins or it's something worse like this. So I think there's it's very predatory and it's, you know, people who are really just trying to do the right thing by them.
And these products just kind of swoop in and pretend like they're organic and natural. And so I can see it. I can totally see it being appealing.
Oh, for
I feel
sure.
like I would love to be able to like have some kind of feeling, but not drink alcohol. Why wouldn't I try one of these bottles?
Right.
They're saying it's like totally fine. Yeah, this person on Reddit says, I was a daily user of this for 10 and a half months. Towards the end, I was at 10 to 12 bottles a day. That's wild. The stuff was killing me. I lost 30 pounds, pale, skin was dry and flaky everywhere. My clothes were caked in dead skin. Ugh. Yeah, and the withdrawals were really bad, worse than I could have ever imagined. It says you recover from it pretty quickly. It took like 3 days of hell and then started feeling better after that. But still, it was like really difficult to go through those 3 days. So I would say, once again, if you have never tried these before,
Don't.
Just don't. Just stay away from them. It's going to be so much harder to stay away from something once your brain knows that it will give it a good feeling. It's just like going to be something you always have to think about now. I'd rather just like not even have that knowledge in my brain. So I would say stay far away from those. Tell everyone you know that those are like way more dangerous than they seem, because I just hate the idea of people like unknowingly taking these things.
Right. For like good intentions too.
Yes. Unlike something like Whippets where you're like obviously doing some kind of drug.
Yeah, you're like, let's go get high.
Yeah,
let's
you just maybe don't realize just how bad it is,
Right.
but you still are doing a drug.
Whereas
with something like Kratom, you're like, I'm going to make a good choice and not drink alcohol.
Exactly.
And then boom, you're addicted to this other substance and it's really expensive and you got to drink 10 bottles a day now.
Jesus Christ.
Yeah.
Wow.
I know. Fucking capitalism, man.
Can we talk about our bod?
Yeah. Well, let's say goodbye first.
That's right.
Yeah,
that's right. I
you can
forget.
Find us in all the places and check us out on all the things.
We're on Reddit.
Thanks for listening.
We're on Finch.
Yeah.
I think I've friended like 4 different people. We're all drinking water.
Yeah.
Never been so hydrated.
Yeah.
Let's share goals together.
Yeah. Tell us your code on Reddit. That seems like a good place for people.
Or you can DM us on Instagram.
Yeah. And chats are happening on Reddit.
Yeah.
So
I'm on Reddit now for everybody asking.
Finally got Kristen on Reddit.
I'm on Reddit. I'm on Christiche Unleashed.
Yep.
That's me.
Yep.
And you are?
I am Schneef Queen.
Schneef Queen.
Yes.
Love it. You can email us at the Gmail.
Yeah.
You can DM us. You can find us on TikTok.
Yeah.
And that's probably about it.
Yeah. Patreon. You can check us out on Patreon for some bonus stuff.
Yeah, we talked about centaurs.
Yeah, we're going to talk about Medusa at some point on there.
Oh, yeah. We were going to talk about RFK.
Yeah.
We got things happening.
Yep.
Yeah.
Things are happening.
Things are happening.
All right.
All right.
Let's do that bod.
I want your bod.
Nice bod. Your bod.
Bod. This bod is so freaking adorable. I'm really pumped about it. It's called the KAKAPO.
Isn't that a dog?
Yeah.
Yeah.
But this is a different, it's spelled differently.
Oh, okay.
I guess you can call it a KAKAPO, but it's KAKAPO.
Oh.
Not
KAKAPO.
KAKAPO.
Oh.
It is also known as the night parrot.
Oh. That's a cool superhero name.
Yeah.
The night parrot. I'm really annoying and I can't help but repeat back an autistic superhero, the night parrot.
The night parrot.
Yeah.
This bird, or it's also called the owl parrot because it kind of looks like an owl a little bit. It's one of the rarest birds in the world.
Whoa.
It's native to New Zealand, and it doesn't even live on like the mainland. It lives on like 3 different little islands off of New Zealand.
Oh my God, to be a KAKAPO.
I know.
I love it.
It's the world's only flightless parrot and one of the longest living birds. It can live up to 100 years.
Oh my God.
Also nocturnal, which explains the nickname. I know.
A nocturnal parrot that can't fly?
Looks like a green chicken.
I've never even heard of that.
I know.
It
doesn't look like a real bird. It looks like a green chicken. Go to one of the 14. Why does this say Fantastic?
I don't know. Why'd you put that in there? Fantastic Four?
No, it's not. It's just like labeled differently.
Whoa. Oh my God. That guy is bodacious.
Yeah.
Very full.
Yeah. Look how cute.
Oh my God, he's so cute.
I know. It's like a little chicken, but with a parrot owl head, an owl parrot head.
He does look like an owl. He's very full like an owl.
Yeah, and
has
so
the
they
face
say
of a parrot.
where the feathers kind of expand around his eyes are very owl-like, and it helps with sound. You know how like the owl's head is like a little satellite dish?
Yeah.
Same with this little guy here.
Cool.
So we have 2 different sounds to listen to.
Right.
One is it's labeled under the Fantastic Four First Steps in theaters July 25th. Why? I don't know.
Great.
But this is
the name on there.
Booming sound, which is one of their mating calls.
Oh.
The male's mating call.
That sounds like someone blowing into a big jug. Doesn't that sound like someone blowing into a jug?
Yeah, like a...
I think we got that one.
Yeah. And here's the next one. This is their chinging. This is also another mating call. It's almost like a ching and then like a wheeze in. Yeah.
You got it. For sure.
You're much better at this than I.
Some of them, yes, some no. Sound a little
Yeah.
donkey-ish.
I wish we need to get an expert bird caller on here.
That would be nice. That would
Yeah.
be nice to like learn something.
Yeah.
But isn't it funny after all these years that we're still so bad at
We're
it?
still so bad
It's
at
on
it.
purpose. We're doing it as a prolonged joke.
Yeah.
Yeah.
It's funny for us.
Yeah.
Boom.
Yeah, I like that one. Boom.
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 Also, who names their parrot Lionel?
Oh, I kind of like that. Boom. Lionel.
You know, it's growing on me. Lionel.
I like it.
Boom, 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 boom.
Some of these birds make noises that don't sound like they're coming from any natural animal.
No.
You know, they sound like computer noises.
Yeah.
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 Like the freaking shoe bell with its
The
machine
shoe
gun
bell.
sound. It's like, how would I even make that?
Right?
Yeah.
And this almost reminds me of the shoe bill and the fact that it doesn't look like it's a real bird.
Yeah, it does kind of
It
look made
looks
up.
very like puppet-esque.
Yeah, it's very cute. Boom.
Yeah, like in the best way, right? Like it's
Yeah.
like so puppety
Yeah,
and
puppets are cute.
cute.
Yeah.
Unlike the shoe bill that just looks like a monster.
Personal opinion. All right.
Boom, 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 boom.
See ya.
Bye.
Bye.